I purposely came early this morning to meet you all and get a feel for who you are and what your challenges you're facing with your kids. And it's been a very enlightening morning for me. I haven't had any experience with children with ILD, but I have a lot of experience with children with special health care needs in the school setting. So I'm hoping to give you a little information on that. Having just had a lecture on stress management, I'm sure the thought of your children going to school, if they're not in school yet, has raised your anxiety and fears to a great level, and I hope to be able to give you a lot of tools to be able to manage that process from home to school. How many of your kids are currently in public school? One. That was kind of the sense I was getting when I was listening to you all. How about private school? One. And how many of your children are currently over age 5 and homeschooled? One. And the rest of you must have preschoolers, right? Raise your hand if you have a preschooler or infant. Okay, good. Well, I'm hoping too to be able to give you a lot of tools so that when you do face entry into the school system, you're well prepared for it and it won't be quite so alarming to you. I also realize that our audience is predominantly not from San Diego, about split halfway California and halfway other countries and other states. So I need to give you a caveat that as you're working with your own school districts, your own states, and your own Department of Education, their rules and regulations regarding individualized healthcare plans may be quite different than California's. So if you take this information home, you'll want to be able to check with your own school districts and see how they manage it there. I better get my notes out. So what in the world is an ISHP? Well, the most important thing to know is it's individualized. Just as your kids are all individualized and their needs are all individualized, that is really the most important fact about an individualized school health care plan. And this is my great nephew Nathan with Michael Phelps about a month ago. And he's an avid swimmer and athlete, and he had the wonderful opportunity of meeting Michael with his mom on the East Coast. They actually live in Northern California, so they traveled to, I'm pretty sure it was Massachusetts somewhere, to meet Michael and swim with him and play with him for a couple of hours. It was a wonderful experience. We'll come back and talk about Nathan a little bit later on. So every school-age child that has a health care concern is eligible to have an ISHP. They also may need a higher level of accommodations than an individualized school health care plan can provide, so they may have a 504 plan. Those kids are still considered general education, and they may have an IEP, which is special education. And Lori's going to be talking a little bit later about 504 and IEP. And so my portion of it is to talk about the individualized school health care plan. Some of my slides will refer to the 504 and IEP. And as you're aware, in the medical community, there's a gazillion different acronyms and alphabet soup, and when you enter into the school system, you're going to run into a whole lot of different acronyms too. But for an ISHP purposes, it's really important for you to know who you're talking to in the schools and what their qualifications are and whether or not they have the authority to actually implement an ISHP at school. In California, we have registered credentialed school nurses. They're the same as your certified school nurses in other states. Some schools have school nurses that don't have their teaching credentials or don't have their master's degrees, so they may just be referred to as a school nurse. You may just have a nurse and not even know who that person is and what their credentials are. And then you'll have unlicensed assistive personnel, which may be a health tech, a health assistant. And again, the level of professional person that you want to work with is either your certified school nurse or your registered credentialed school nurse. Welcome to the Canadians in the back. My 3 granddaughters live in Edmonton with my daughter, moved from San Diego to Edmonton. I think she's crazy, but that's where they are, so I'm traveling up there quite frequently. Yeah, it probably is warmer there today. Okay. So 504 and IEP, 504 plans, again, are general ed, and IEP are special ed, and kids with very complex medical conditions who do not have a learning disability may qualify for special education under other health impaired. And a lot of your kids that are more advanced in their disease process probably should have IEPs, and the children that have less advanced disease process can easily be provided care under 504 or individualized school health care plans. The school health care plan also is referred to as just an individualized health plan in other areas of the country, includes the physician orders and includes the emergency care plan, and the medical management plan is the same as your physician orders. So those things are all rolled together, and so I wanted to give you some terminology to get started with. So your child is the center of your universe and the center of the care we provide for your kids in school. And around them orbits several planets, and these planets all have their own systems and rules and regulations, and it's probably the most frustrating thing about interfacing with the schools is everybody's rules kind of converge in the schools. So when you're working as a school nurse with families, you're working with the community, the family, the medical community, and the school itself, and trying to make sense out of all those rules. I'm just not going to use my notes because I'm way ahead of myself. The medical community, they have their own rules and regulations. In the schools, we have to follow the rules and regulations of the Department of Education, and the nurses have to work under the Nurse Practice Act. And so when you've got all of these different organizations telling people what to do, often there's misunderstandings as to why, as a parent, you can't just tell the school what to do with your child. You have to go through your physician, and it's because of these other organizations that govern our practice that we have to abide by their laws too. So that's very frustrating. And in the home, you're the primary caregiver, and you're the one that can call the shots in the home, and all of a sudden you come to the school and you don't have that ability to call those primary shots all the time. You absolutely are a key member of the team, and the most important member of the team, but we still have to work within the laws of wherever you are and whatever is being governed there. There's other things that are real important with the family and the community. It's your wishes and desires, your personal faith and beliefs, and the emotional impact that the disease process has on your family. So hopefully, again, as we go on, I'm going to reduce your stress rather than increase it. So what is an ISHP? An Individualized School Health Care Plan, or IHP. It's an explanation of your child's health care needs. It's an interpretation of the doctor's orders and nursing care to lay staff at the school, to the teachers, to the secretaries, to the health aides who you're entrusting your child's care to. They need to be taught how to care for your child, and it's not always appropriate for the parents to do all the teaching. Again, in California, the Board of Registered Nursing requires the nurses to do that teaching, so we often co-teach with the parent and bring you in and work, because you're the primary caregiver and you know what's going on, but the nurse has to be there to do the teaching in California. It's a stool. Okay, that's good too. It's a tool for staff communication and a means of collaboration between the parents, staff, and providers. It's a tool for continuity and consistency of care, and it's a documentation on how emergency care will be provided. It's a flexible document that changes as your child's health care condition changes and as staff needs changes. It's confidential. It needs to be stored in a confidential place, but it needs to be accessible. So what about a substitute teacher coming in that's not familiar with the child? They have to have access to it. So we need to make sure it's in the subfolder and that the substitute teachers are trained and aware of your child's health care conditions. It's all these things are included in the ISHP. And it's not a substitution for nursing judgment, and that's why we ask that it be the appropriate level nursing support or the appropriate level of caregiver in your school setting to provide guidance in this process. It is how school nurses nurse, and it is the nursing process in action. And the nursing process is a little bit of our theory and foundation of nursing. So a couple of statements. I'm not going to read these for you, but this is the National Association of School Nurses, their definition of an IHP. And it's in your handouts, which I put at the edge of each table, pass them inward or outward. And then the California School Nurse Association, again, the definition of what an ISHP is. So we're talking about a process of intaking your child into the school, managing that care, and changing the care as your child's needs change. One of the key factors for schools is that we have to ensure that the caregivers are appropriately trained and that their caregiving is monitored on a regular basis and that they are competent to perform the care needs that your child has. So that's the teaching aspect of your certified or credentialed school nurse's job. And we need to look at it and modify it and change it over time. And the primary reason in the schools that we want to do this is so that your child can reach their optimum potential educationally, that your child's illness and condition does not impede their ability to learn, and that they're not discriminated against because of their disability. It's very important. I just had the privilege this year of bringing a little girl into school, into a comprehensive site, and she has spinal muscular atrophy, SMA1, and she is quadriplegic, paralyzed. She's on a ventilator, a G-tube, on oxygen. She comes to school with a licensed vocational nurse, and her motor skills consist of this: and eye movement. That's all she can do. So we have a computer for her. We have a laser pointer that she breaks the beam of the laser pointer. And in the last year, we have discovered with this technology that she can read. She can move the cursor around. She can identify letters and numbers, and she can answer questions, yes and no questions, and colors and numbers and all things that a typically developmentally appropriate kindergartner can do. And it's because of my involvement with bringing her into school. I'm an area nursing coordinator here, over 15 schools, and I do a lot of special education. And next year I'm going to be the home hospital nurse for our school district. So I was really excited to see what's happening with this little child, and very, very exciting to see her in school. And of course, all of her medical needs have to be met, but her socialization needs are also being met too, so that's good. And you can read this later. So this is the nursing process, and not important for you to know, but to understand what it is helpful. It's the assessment, diagnosis, the outcome identification, planning, implementation, and then reevaluation. And it's a cycle that goes on and on. So we're all constantly looking at what the child's needs are and what teaching needs to be done and what we can do to help the child to care for themselves and help staff know how to care for them. It's the who, what, where, when, and how we're going to implement the doctor's orders. So it's collaboration with the family and accommodation needs, interpreting the physician orders again. But things that would fall under this category would be like the daily schedule at school, who's going to push the children that are in wheelchairs from point A to point B. How are we going to accommodate PE when they have limited vitality and endurance? You know, and that if they're not special ed and it's not defined in their IEP, then we can define it in the ISHP. What if they need a rest period? We want to define it in the ISHP. Special nutritional needs, and if they have an IEP, a lot of their specs in California, specialized physical health care services. I'm not sure what they call them elsewhere, but the G-tube, the J-tube, the oxygen, the Foley catheters, the special medications, all those procedures that are provided for kids in school are meant via an IEP or a 504 typically, and then the other accommodations, just the day-to-day being in school and being accommodated at school, are in your ISHP. interesting, what I was just really shocked by this. In California, there's no mandate for an ISHP. The only place that it's mentioned is in our asthma action plan. So our asthma action plan is an ISHP. It's a one-page document for children with asthma that defines how to take care of their emergency health care needs. It describes their inhalers. It's the physician orders for their inhaler. It does not include the Pulmoaid. That would be a spec, and that's another project, another process. But that's the only legal legislation for ISHP in California. Another example would be our food allergy kids. So we have a food allergy action plan, which is an ISHP for a food allergy child. That is just a 2-page document. That may be all those kids need. It's their general ed, they have the inhaler, or they have a food allergy, they need someone trained to give them the EpiPen. That may be all that child needs. Another example would be our diabetic kids. And right now we have over 300 type 1 diabetic kids in San Diego Unified School District. So I spend a lot of my day going and giving insulin to very small children, especially at lunchtime, and teaching them how to use their pumps and teaching them how to give their injections to themselves and supplementing the training that's been going on in the doctor's offices when with their endocrinologists. So that's part of our special physical health care needs. And those kids, most of them have 504 plans. And a few of them, if they have learning disabilities, also have IEPs. So this is a page I want you to pay attention to now that you've got the background. And I wrote this just for you. This is the parent planning stage. If you can't read it, it's in your handouts. But what you can do as a parent to get ready for school, it will take you at least a 4-hour meeting with your school support staff to get your ISHP in place with a child with moderate healthcare needs. If your child has complex healthcare needs, it's going to take a lot longer. If your child has mild healthcare needs, it won't take as long. But you want to, as a parent, this is what you can do if you don't have access to a school nurse. This is how you can prepare to do business with the school district. It's very important that you find out who your access person is at the school, who's responsible for writing your healthcare plans, and who's responsible for implementing them. But you can come in prepared, like you all are. You're great advocates for your kids, or you wouldn't be here. So you want to identify your specific healthcare needs for your child, their diagnosis, their physical healthcare needs, consult with your medical provider, and research using a reliable web source. I know earlier today it was mentioned to stay off the web, stay off the Google searches, and I agree with that. But if you are going to Google it, make sure you look at your resource and make sure that the information is evidence-based scientific information that you're gleaning for your child's plan. Identify the best qualified resource person in the school district. In California, that is the registered credentialed school nurse, and who's responsible for writing and implementing the plan and making changes to it. Again, it's the certified school nurse or the registered credentialed school nurse. Can it be you? In California, the answer is no, but there's lots of school districts in California that don't have a school nurse accessible, and they probably are district-based or county-based nurses, and you may want to connect with them and find out what the plan is for the school that your child is attending. I've learned a lot about working in a non-metropolitan school district, in a rural school district. My great-nephew Nathan, that we'll be talking about a little bit more, both his mom and dad are teachers in rural Northern California. And so I've been talking to them and weighing this rural, metropolitan, and what we do in San Diego isn't what's happening up in Weaverville. So I've been able to send all of my documents from San Diego up to his mom and dad, who have gone to the doctors and filled them out with the doctors. And mom goes back to the school and teaches with the school staff herself, and the nurse that is usually there one day a month was present and was nodding the whole time because she'd never seen the complexity of the documents that this mom was presenting, because mom got it from San Diego, which is huge, which we do this all the time, and they don't have them up in Weaverville. So it really has worked out well. So connect with whoever your professional nurse is and know that that's a key person to advocate for your child and to meet your child's needs. You're going to need a whole lot of doctor's orders and a whole lot of forms for those specialized physical health care procedures, and a signed HIPAA release or a release of information. That's very important. And you're going to meet with the school nurse and then a staff of a team from the school to actually go over the plan and to make sure all the unlicensed people know what they're going to need to do for your child. And a lot of your kids may need to have a licensed nurse with them through the school day. It probably won't be a school nurse who has a minimum of a bachelor's degree, but it might be a licensed vocational nurse. That's a nurse that has a 1-year degree or even a 2-year degree RN that's not a school nurse. So that's why I wanted you to know the difference between the nurses. The nurse isn't a nurse isn't a nurse. And you guys are better nurses than most of the nurses are. So staff training and implementation again. Super Nathan. So Nathan's my buddy. He was diagnosed at age 2 with diabetes, and he's got his pump on his belly there around his waist. So we have a lot of diabetes in our family, so that wasn't a surprise to us. But when Nathan started having seizures that weren't responding to the glucagon that was supposed to raise his blood sugar back up, they took him to the hospital and the ER and ended up down at UC Davis and did a brain scan to find out why he was having seizures. Well, he's got total whiteout on his brain, but he's a normal acting child and physically active child. Why does he have a whiteout on his brain? The doctors were saying this brain scan is not consistent with the child we're seeing. So they started working him up so now he's got diabetes and seizure disorder. They started working him up for a leukodystrophy, and he went all the way to Washington, D.C. to a specialist on leukodystrophy and said, nope, not leukodystrophy. So recently, just in the past 2 to 3 months, he was finally diagnosed with a mitochondrial disease. So why did I hand you out a mitochondrial disease, which is not an ILD? It's in your packet. It's because the accommodations they had on their website I like the format. They're classified. They're not specific for the forms because all of your districts are going to have their own forms for their IHPs. But that website, that foundation had a list of the needs for that child for that diagnosis. And as I read it, I see a lot of similarities with the kids that I've reading about that have ILD. So I would encourage your child foundation to pull together your resources. I'd be happy to help you with that. And let's write up our own accommodations for kids with ILD for the schools so you have a tool to go to the schools with, and then they can create the IHP on whatever form they want to use. So diabetes, seizure disorder, neuromuscular deficit. The mitochondria are the powerhouse of every cell except blood cells. And as it is a progressive degenerative disorder, so we don't know how long that process is going to go on. But over time, he's going to continue to lose neuromuscular function. He's starting to lose it now. He's starting to become weaker now. And so fatigue and endurance and pain are very obvious to us now, but in the future, he's going to need a lot of the equipment your kids need, those of you that have children with more advanced disease. So ventilators, G-tube feedings, oxygen, and all of those things are going to, hopefully a very long time down the road. We don't know how long it's going to happen. But the emotional support to his parents and his 2 brothers is just going to be really key for us. We don't know what the future holds for Nathan, but he is Super Nathan, and he is just determined to beat this whole thing, and I'm not real sure what his level of understanding is, but he knows an awful lot about diabetes right now. Okay, I'm going to turn over the computer and the mic to Lori, who's going to talk to you briefly about 504 and IEP, and then we're going to come back and I'm going to show you some samples of ISHPs and answer your questions. We'll do a question and answer period. Okay.
I hope you guys are enjoying your trip here to San Diego. I'm sorry it hasn't been so sunny for you yet. It usually is. It's beautiful here. My name is Lori Brust. I'm a social worker. I work at Rady Children's Hospital in the pulmonary clinic. I see a lot of the ILD patients that Dr. Haygood has. Have any of you here met Dr. Haygood? Yes. Okay. Right. Oh, great. Okay. He's a wonderful physician. So the patients that Dr. Haygood sees in the pulmonary clinic at Rady's, I usually see most of those patients depending on what type of insurance they have, of all things. So I am going to be speaking to you a little bit today about comparing the IEP and the 504 plan. This is actually a presentation that was developed by our teacher that works at Rady's. She's employed by San Diego Unified School District, but she is assigned to the patients who are admitted to Rady Children's Hospital. So unfortunately, she's having a great time right now in Kauai instead of coming to this conference. So she's really the expert more on this than I am, but I did volunteer to do it for her since she was not here. So there are 3 federal laws that govern the education of students with disabilities, and those are, Linda mentioned them briefly, Individuals with Disabilities Education Act, or IDEA, the Section 504 of the Rehabilitation Act of 1973, and the American with Disabilities Act, or the ADA, a lot of acronyms, as Linda said. So under these laws, all students with disabilities ages 3 through 21 have a right to receive a free, appropriate public education, and that's one of the key things here is these apply to public schools. The IDEA authorizes funding to states and school districts. These agencies must comply with specific rules regarding the education of students with disabilities. The IDEA only applies to students having specific disabilities that are identified through the required assessment process.